The private healthcare debate has been sparked again following Ontario's move to expand the delivery of public healthcare services to private centres. Premier Doug Ford says this is in an effort to help eliminate the backlog of procedures. Now, he says these procedures will continue to be paid for by the Ontario Health Insurance Plan. But critics are concerned about what the plan will do to hospital staffing levels. The announcement has also garnered a variety of reactions from the Prime Minister and other federal leaders in regards to maintaining the universal public health care system. Well, joining us now to give us deeper insight into this issue is Colleen Flood, Research Chair in Health Law and Policy and Professor at the University of Ottawa. Ms. Flood, welcome to Forum Daily.
Thanks for having me.
So let's start by going over this new three-step plan in Ontario and what exactly it will look like for patients in the province.
Well, I think that's a tricky question because there's not a lot of detail provided. But essentially, it sounds like the plan is to expand the sort of current array of services that are provided through private for-profit and not-for-profit clinics outside of hospitals. So the usual things like diagnostics, MRIs, and these kinds of things. But then to further expand eventually into other kinds of elective surgery, so cataract surgery and hip surgery. But there's not a lot of detail provided as of yet of how all of this will occur, how it will be regulated, how it will be funded. So we just have a general sense of expansion sort of slowly, but then ramping up into areas that historically, have been delivered inside public hospitals.
Now, meanwhile, we're hearing a lot of concern around the stability of the public healthcare system and hospitals amid these investments in private care. So, what are your thoughts
Mhm.
on this? How would this likely impact the public system?
I think the biggest concern here is the diversion of nursing staff to these centres. And, we already have such a problem at the moment with the burnout and toll that particularly nurses, but other healthcare providers have endured for the last 3 years of the pandemic. So, to set up perhaps another place where they might be able to go and work rather than inside the public hospitals is quite concerning right at this point in time. Perhaps at another point in time, if we felt we had, a robust supply of nurses and other healthcare providers, it wouldn't be so worrisome. But I think, up and down the country where we've heard terrible stories of overcrowded ERs, people dying in ERs, people not being able to get care for their kids, many people not being able to even get into a wait list because they can't see a family doctor to even, be queued to see a specialist. So, for my 2 cents, this is where if we've got an ounce of extra capacity, I would hope that this is where the government would really be trying to put the resources. This is where we really desperately need it right now. And not to say that addressing wait times isn't really, really important for cataract care and hip operations, but I think right this moment the crisis is in the ER and in primary care.
So, what would be your suggestions around improving the public healthcare system from your own personal perspective and research on healthcare systems around the globe? Just about a minute and 20 seconds left here, ma'am.
Well, yeah. Oh, you don't want me to give you my doctoral thesis. Um, the first thing that would be great is if we actually had a central queuing system for folks, so that instead of my family doctor just, sending me to the orthopedic surgeon or the cataract surgeon that she happens to know, that there's an orderly kind of procession through regional or provincial method so that I'm matched onto the first available surgeon depending on my acuity. So we have no idea, when my lovely family doctor, I'm so lucky to have one, sets me up with, orthopedic surgeon or something, whether someone just down the road or, an hour's drive away might have had a cancellation. So, these are some pretty low hanging fruit that we could really do really quickly to improve people's access to care and give them security, that they aren't just sort of hanging in the wind, that, that the system is looking after them and that their needs will be met just as soon as humanly possible with the resources that we have.
All right, Miss Colleen, thank you again for your time today on Forum Daily. We appreciate your perspective.
My pleasure. Nice to talk to you.